Hi everybody, my name is Angel and this video is going to be about Clubfoot. This is going to be a part of my pediatrics playlist, okay? Alright, so let's find out what is Clubfoot, what are the symptoms, causes, and how do podiatrists treat them, okay? Alright, so a clubfoot is a congenital deformity. As you can see, the foot is actually on the inside, they're inverted. Okay, there are different types of clubfoot, but usually these are very much inverted, just like this. Okay. Alright, as you can see here, this is a newborn child. And as you can see, the foot is deformed and it's on the inside, right? A clubfoot is a condition in which one or both feet are twisted into an abnormal position at birth. Clubfoot is a very common birth defect. Other terms are congenital, talipes, equinovarus, right? So CTEV. Condition is also known as talipes. It's a general term used to describe a range of unusual positions of the foot. Present at birth and affects foot and ankle. Okay, so it's present at birth and it's usually impacting foot and ankle. Alright, it is a common birth defect. It is a common birth defect occurring in about 1 in every 1,000 live births, right? Approximately 50% of cases of clubfoot are bilateral. Okay, it happens on both the feet, both the foot. This occurs in males more often than in females by a ratio of 2:1, so half. Okay, half is the ratio. Okay, main cause is a result of arrested or anomalous development in utero. So the theory of arrested fetal development suggests that the foot's normal development is stopped during the 9th or 10th week of embryonic life when the feet form, right? So during the 9th or 10th week of embryonic life, when the feet are forming, the normal development of the fetus is, stopped. This prevents the foot from correcting to its normal position at birth, right? So it creates like an abnormality, and it's because of the deformation of during the 9th or 10th week. Congenital malformation of the lower extremity that affects the lower leg, ankle, and foot. As you can see, this is normal, and this is clubfoot in a baby. It's on the inside. As you can see, it's not only impacting, the walk, but at the same time, it's also impacting. Understand this deformity right here. Chances are the child won't be able to walk, and if the child walks, it's going to be very painful, right? As you can see, there's a lot of space in between here, right? So congenital malformation of the lower extremity that affects the lower leg, ankle, and foot. Congenital refers to a condition or trait that is present at birth. It describes a structural or functional abnormality that develops during the fetal period, before or at the time of delivery, right? Okay, so what are the causes? The family history of the clubfoot, right? So there's someone in the ancestry where they may have had clubfoot. So it's a genetical deformity. Position of the baby in the uterus. Yes, that is also very important. If the baby is not in the right position, then the feet may develop in an incorrect position. So there you go. Increased occurrences in those children with neuromuscular disorders, related to neurology and also muscles, right? Such as cerebral palsy and spina bifida, right? It may also be caused by the amniotic band syndrome and oligohydramnios, right? So cerebral palsy is permanent problem with movement, balance, and posture, right? That's cerebral palsy. Spina bifida is a birth defect that occurs when the spine and spinal cord don't develop properly in the womb. Okay, that is, neural tube does not develop properly. Yeah, so that's why it happens. Amniotic band syndrome, ABS, is a rare congenital disorder that occurs when thin, fibrous band of tissue, amniotic band, separate from the inner lining of the amniotic sac and become entangled around the developing uterus, right? So it is due to the amniotic sac and become entangled around the developing fetus. That may also include the umbilical cord, that develops around the baby. Okay. Oligohydramnios is a serious condition that occurs when there is too little amniotic fluid surrounding a developing fetus during pregnancy, and this usually happens during the third trimester, right? So OH is a serious condition that occurs when there is too little amniotic fluid. All right, so what are the different types of clubfoot? One is talipes varus. The most common form of clubfoot, the foot generally turns inward so that the leg and foot look somewhat like the letter J, right? So varus is inward. Vulgus is the foot rotates outward like the letter L, right? That's vulgus is outside. Talipes is equinus. The foot points downward, similar to that of a toe of dancer. You know equinus, right? So it looks like a toe of dancer, right? Talipes calcaneus, the foot points upward with the heel pointed down. It's calcaneus, right? So it shows an abnormality of calcaneus. So you're literally walking on your calcaneus. Must be very painful, yeah? All right, types of clubfoot. This is varus. This is vulgus, right? So varus is the general type, which is inward. Yeah, it looks like a J. Vulgus looks like an L. Equinus is, as in you're walking on your front, right? As you can see here on your ball. Equinus, it looks like a horse or a toe dancer. This is calcaneus, where you're literally walking right here. It's like it's very hot and you're trying to, walk on hot or wet. So that's why you're walking on your calcaneus. Must be very painful for the child. All right, so what is a pathophysiology? Predisposing factors, family history of clubfoot, position of the baby in the uterus, increased occurrences in those children with neuromuscular disorders such as CB and spina bifida, ABS, oligohydramnios. Distal limb amniotic banding, and amnion forms constructive bands around the limb in utero. Cutting off the circulation of the limb, yes, because there is no blood circulation around the limb. That causes, arrest of the fetal development in the fibular stage. It causes defective cartilage anillage of the talus, resulting in further abnormal or arrested development. It has an impact on the talus bone, right? So arrest of fetal development in fibular stage. The fibular stage is a period of rapid growth in foot during fetal development when the embryo is 21 to 30 millimeter long, which is roughly 8.5 to 10 weeks into gestation. During this stage, the distal ends of the fibula and the lateral foot skeletal elements grow, causing the foot to undergo structural and morphological changes. So it happens during the fibular stage, rapid growth of the foot during fetal development when the embryo is 21 to 30 millimeter long. Okay? So it's around 8 to 10 weeks into GA, gestation period. Okay? So diagnostic procedures, how do podiatrists diagnose clubfoot? They can do it through CT scan, antenatal ultrasound scan, right? After birth, it can be detected by means of looking at its shape and position of the foot, right? And the x-rays would help. All right, so this is the ultrasound. As you can see, you can actually see the foot turn inward. So this is like a J letter. Okay, this is varus type of clubfoot. Prenatal ultrasound is the most common way to diagnose clubfoot, a condition where a baby's foot turns inward and downward, right? Clubfoot diagnosis at 13 weeks, about 10% of clubfoot can be diagnosed. At 16 weeks, trans-abdominal ultrasound can detect the clubfoot. 24 weeks, about 80% of clubfeet can be diagnosed. A doctor can also confirm a clubfoot diagnosis with a physical exam after birth. During the exam, the doctor will assess the shape and the position of the foot, move the foot back and forth to feel the bones and connective tissue. Clubfoot occurs when a baby's tendons are shorter and tighter than normal, causing the foot to twist, right? So clubfoot can also occur after birth because the baby's tendons are shorter and tighter than normal, okay? It can be caused by several factors, including genetic syndromes such as arthrogryposis or congenital myotonic dystrophy, right? Which is a kind of muscular dystrophy, and arthrogryposis is kind of arthritis. You have already weak bones, right? A chromosomal abnormality such as trisomy 18, right? So this is a chromosomal abnormality of the chromosome 18, right? Multifactorial. This is exactly why I believe we just said that it happens more in male versus female, right? Multifactorial birth defects such as neural tube defects. We just talked about it, right? Neural tube defect. Most cases of clubfoot can be corrected after birth with manipulation and serial casting. Okay, the sooner you treat a child, the better, because once you are adult, it can be treated, but you will need several sessions with your doctor, with your podiatrist, and your therapist. Okay, you need a lot of exercising, but the best part is doing it while you're still 2 3 years old, 1 2 3 years old. So by 5 years of age, your feet are perfect. Okay, it is a very long-term treatment, but you need a treatment. So x-rays are also the finest way of finding out. As you can see, these are invert. This is letter J. It's an invert varus foot, which is actually the most common. It consists 3 stages. Correct the deformity. How do you treat it? Correct the deformity. Maintenance of correction until muscle balance develop. Follow-up observation to detect reoccurrence. The Ponseti method is a popular treatment that involves serial casting. Podiatrist stretches the baby's foot and applies the cast that goes from the toes to the upper thigh. The cast is replaced every few days, moving the foot closer to the correct position. The Ponseti method is very effective treatment for clubfoot, helping children achieve normal or near normal foot function. A healthcare professional assesses the baby's foot. The podiatrist assesses the baby's foot. And the second step is serial casting. So this is serial casting. Gentle manipulation and weekly casting gradually correct the foot's position, right? Achilles tendon tenotomy. This is a very minor procedure to release the tight tendon if necessary. Number 4 is final cast, applied after tenotomy to maintain the correction, right? So this is the final casting, as you can see. Bracing, wearing a foot brace to prevent reoccurrence and ensure long-term success, right? So bracing is a very important part of creating the permanent change for your club feet. Follow-up care is also very important. Regular checkups to monitor progress and make adjustments, right? All right, so correct deformity, like I said, that the only way you can do it is by creating cast to make sure that the feet is actually at the right location. All right, so the clubfoot brace, often just called as an orthotic, has 2 parts: a bar, usually metal, and special shoes or boots that attach at each end. The bar is the same length as the distance between the baby's shoulder, right? So the measurement is like the baby's shoulder, not wider, not too narrow. It slides or clicks into the bottoms of the shoes, right? So it's like skating. The brace keeps the fixed club foot or feet in the correct position, so it doesn't twist back to where it was before the casting phase. Both feet are braced even if the club foot is only on one side. Okay, so even if the club foot is only on one side, both feet are actually braced, right? To make sure that one does not drift apart from another, because let's not forget, we are working on feet, we have to work on both, because both have to be at the right location, right? The bracing phase will last 2 to 5 years. A child will wear the brace all the time, except during baths, right, for about 3 months, and then only during naps at night after that. Okay, so the bracing phase will last 2 to 5 years. However, there are some cases where the baby will be able to take it off, right? Permanent correction of a clubfoot takes time. It's important for parents to work with the care team, follow the treatment plan to help their child get the best possible result, right? The Ponseti method is successful for most of the kids with clubfoot and will let them walk, run, and play without pain. So the Ponseti method is actually very effective, but like I said, you have to do it at a very younger age than an adult age. As you can see, these are the club feet, right? They're more on the invert side because of Ponseti method. What they did was they created a better distance, so it can go up, down, or it can go forward, backward, so you can actually exercise your baby's legs, right? As you can see, the legs are swollen, right? Obviously. Now, these boots are also special boots for those that have club feet. Alright, so maintenance of correction, special clubfoot shoes, observation for reoccurrence deformity is also very important. Alright, so as you can see, this is a baby with club feet, and guess what they did? It's perfect to the shoulder length, right? This is a perfect example of, the Ponseti method, right? So as you can see, this is a baby. Right here, the two shoes. And this is exactly how it looks. So it can click and go back and forth, but it can also go upward and downward, okay? Usually what a podiatrist would do in case of pain, they would give an oral suspension for children. However, the best way to handle it is, just make sure you observe your child's treatment, and make sure that, you give them some time to extend legs. Nursing response will review the pathology, prognosis, and future expectation to mothers. So it's very important to explain the patient, and provide knowledge base from which parents can make informed choices. You can also discuss deformity and expect treatments in terms the parents can understand to rule out misconception, to provide information about the deformity. So be honest about it, okay? Have realistic goals for the patient, and not something that looks like a pie in the sky type of prognosis. Encourage parents to hold and play with the child and participate in care to promote bonding. Yes, so there is a psychological impact on the child, especially when the child starts observing that other kids are playing and the child's not playing, etc., etc. So bonding with your child is incredibly important, and you have to encourage the parents to bond with the child. Yeah. Assess and teach parent to assess for signs of excessive pressure on skin, which is true, right? You're wearing shoes, you're wearing the brace, and there is going to be a pressure on the skin, especially with the child, because their bones are still not that strong. Okay, they're very elastic, they're moldable. Redness, excoriation, because the signs require immediate evaluation intervention, right? Especially when your baby starts having issues with skin tenderness or redness or itchiness, or it develops moisture. All those things can create yeast infections very easily. Elevate the extremity to promote venous return and prevents edema. Alright, so you can actually elevate the extremity, so even if the baby's wearing the braces, the orthotics, what you can do is you can raise the leg and drop it, and raise the leg and drop it with your hands, not on the floor, just raise it and put it down. That would actually help the venous system, the venous drainage, and also improvises the blood circulation, right? Check the toes every 1 or 2 hours for temp. Yeah, toes may get very warm, and you may want to make sure that you clean it very well. Sensation, motion, and capillary refill time. Okay, so also check the temp and the color. Is it too dark? Is it too pale? Or is it blue? Okay, what is the color? It's very important, right? Stimulate movement of toes to promote circulation. Insert plastic petals over the top edges of new cast while it's still wet to keep urine from soaking and softening the cast, right? So it's important that you can use plastic petals to make sure there's not a lot of water insertion, okay? And that includes urine insertion, too. Provide comfort measures such as soft music, pacifier, teething ring, or rocking to promote relaxation may enhance patient's coping abilities by refocusing attention. Alright, so provide comfort measures such as soft music and teething ring, which is very important, otherwise the child may get annoyed and it may impact their psychological development. When the kite casting method is being used, check circulatory status frequently. Circulation may be impaired because the kite casting is a little tighter, right? But it helps with equine correction, especially places considerable strain on ligaments, blood vessels, and tendons, right? So kite casting is a very, very important method, but most of the time it is the method with the braces that helps. Okay. Discuss the importance of physical therapy to enhance mobility. What is the diagnosis? Okay, it's a risk for disproportionate growth related to congenital disorders. Okay, so if you do not treat the clubfoot, then chances are this defect may cause a growth-related issue. The impaired physical mobility-related musculoskeletal impairment may be present as well, right? Impaired skin integrity may be present. At some places it may be rough. At some places it may be very tender. It can be a little reddish in color too. Disturbed body image related development changes, which is true, because if you have clubfoot, then chances are people are going to, especially the kids, bullying is also very common, so that can be a concern as well. Social isolation can be a concern too, because social isolation can be because you cannot play with other kids. You have to you cannot make a lot of friends, you cannot go outside, so it has a serious psychological impact on the child, and this is exactly why it's important to treat it before 5 years of age than to do it later. You can do it later, but it's better if you do it early. All right, so like, subscribe, and share, and comment, and let me know how you like the video. Bye.